All right, so we're going to get cracking with the short presentations. If everybody could be quiet. I've handed out some just brief introductions to our youth response, which should be at your tables now. There's also additional information about this project in your registration package, so there's lots of information here for you, as well as many people who can give you more if you want to flag down me or Jackie or any number of our co-investigators and researchers. So I'm here to talk to you today about our Youth Response, which is the project that led to this event happening. Our Youth Response is a 3-year interprovincial research study funded by Nova Scotia Health Research Foundation. Right now we're about a year and a half in, so we're about halfway through, and we're starting to have some of our findings, and we're starting to move into a new phase of our research. So the purpose of the study is to look at the current state of primary and secondary HIV and hepatitis C prevention policies and programs, specifically aimed at youth, aged 16 to 25 across Atlantic Canada. So we are doing research in each province individually, and then we're all bringing it all together so that we can compare it and kind of look at the differences between the provinces. So Jackie Gahagan, who you guys were introduced to earlier, is the primary investigator, and she leads the research team, which is composed of one researcher and 1 or 2 policy trainees in each province. So we have a lot of our researchers here. We have Mark Dykeman, and we have John McDonald, and Greg Harris should hopefully be joining us tomorrow. Pam, who you guys met at the registration table, is a policy trainee on this study, and is there anyone else I'm missing? I think that's it. Lois is a co-investigator, and Jeff Carabinell will be joining us later as well. So there's a lot of people involved in this project, and I think people are excited about it, or I hope so. So we all meet regularly by teleconference, and we work really collaboratively, and our goal is to make sure that we're building a cohesive methodology so that we can do our research independently and meet the kind of individual needs of each province in terms of how do you find information and who has information. But then when we bring it all back together, that it's really comparable, and we can kind of make those comparisons and hopefully exchange information between the provinces in a way that's meaningful and relevant. So, to date, sorry, I lost my notes, 1 second. Yeah, so to date, the Our Youth Response research team has finished kind of 2 major sections of our research. So we have undertaken a large-scale comprehensive policy and program scan, which means that all of our researchers went through every policy and program that they could find in each province and made basically a database of what exists. So that in and of itself is interesting because you can see kind of where policies don't exist to include these people. And we focus on 4 major sectors, and that's health, education, corrections, and community organizations, which might include aid service organizations or youth groups, basically a very wide variety of things. And it's really important to this study that we are cognizant of the disparities in health that are experienced by Atlantic Canadians in comparison to the average Canadian, as well as looking at the specific risk factors that youth have to deal with, and recognizing those and acknowledging those and looking at ways to minimize risk and to make sure that youth are educated and that policy provides a certain amount of protection. So once we found all of our policies and our programs, we ended up reviewing a total of 425 documents. So that was 133 in Nova Scotia, 81 in New Brunswick, 149 in Newfoundland, and 62 in PEI. So there was a lot of reading, and what we did is we looked at all of the all of the documents, and we devised a coding scheme so that we could rank each article in terms of how well it did in terms of discussing and mentioning categories that we deemed important. So, and when we chose these categories, we were using a couple different lenses, one being youth focus. So in terms of youth focus, we looked at whether or not every document was developed in partnership with youth, as well as whether youth were the focus of the document. We also used gender-based analysis. So we looked at sex, gender, gender identity, gender roles, gender relations, institutionalized gender, and then diversity and equity as well. So that really covered a great range of I guess, diversity as a whole, and looking at whether people are missing from the policies, not that they're necessarily not included, but where special considerations are needed. If they're not there, this coding scheme really helped us kind of pick that out. And we also rank things based on whether or not they pertain to urban populations or rural populations, because we wanted to see if specific geographic areas were being left out, and whether or not there was a way that we could make recommendations to make these policies more inclusive or more relevant to everyone. And then finally, we noted all the novel or wise practices that we found. So that would be where people are doing a program differently or a new program, and where we thought it might be useful or it might be good to try to implement that somewhere else, or to identify the innovation that people have been kind of undertaking and where they have been succeeding, and to celebrate that. So all of those categories we ranked on a scale of 1 to 3. 1 meant that they were very well discussed and thoroughly mentioned. 2 meant that a concept was mentioned but not really there, kind of superficial. So for example, youth focus, if the word youth was in there and they mentioned youth but they didn't talk about the implications of the policy for youth, that would be 2. And then 3 was where the concept was missing entirely. So following that, we have amassed many a chart of the percentages of documents that thoroughly discuss these topics. And so I threw on this sheet just for you guys, just for one example, kind of the gaps that we were able to identify by doing that process. So what I have on here is 2.2% of the documents from Nova Scotia were developed in partnership with youth. 22% were developed with youth in New Brunswick, 6.71 in Newfoundland, and 24.19 in Prince Edward Island. So there's a fair amount of variation you can see there, which is bad, probably. Although it's interesting because you can see the links to, like, Prince Edward Island, we only had 62 documents to review. So we can't draw those conclusions, but perhaps that indicates that when they are making the effort to make a policy, they're drawing more people in. But that could be a suggestion as to what that may mean. So there's a lot of information like that we're starting to sift through. That's going to be really interesting to look at and to create some recommendations to go forward. So another part of our project is to spread information, much like this workshop. So we're doing a lot of work to try and make the information that we're getting accessible. So in November, I know some of you attended our Café Scientifique, which we hosted at Just Us Cafe on Spring Garden Road. It was an event aimed at youth, and we talked about HIV and hepatitis C prevention, and we had some speakers. And you can see over here we've got a canvas that the youth at the event painted on and wrote their thoughts on about prevention and education, and the title of the event was "What if it was youth?" And that meant what if it was youth making decisions, what if it was youth creating policy, and what if it was youth creating programs. So you guys should come up and take a look at this later. It's really great. We also got some help from a hepatitis group and a GSA in Fall River. Actually, they took the canvas for a while and added their thoughts as well. So it's made the rounds, and it's got a lot of creativity and a lot of interesting stuff on there. This event as well is part of our effort to make sure that people are making connections and sharing information. And we're working on setting up a YouTube channel with lots of information for you guys. All of the presentations today will be chopped up into 10-minute segments, so they'll be really accessible, and you can watch them, or if there's a program that someone speaks about today that you want to tell a friend about, you can just send them a link to the YouTube video and they can kind of see who's involved in that program and what they might do to look into implementing on their own. So currently in our Ether response, we are in the process of recruiting participants. As San mentioned, there is a recruitment flyer in your package. We are looking to interview key informants from the health, education, corrections, and community organization sectors, as well as youth themselves, about what they see as important in HIV and hepatitis C prevention, and where they see gaps in policies and programs. So if you're interested, or you have a friend who may be, make sure you're sending around that flyer. And we're really looking forward to seeing where that goes. And then in the future, once we're done these interviews, we will be coding them for information. And from that coding, we'll create a new interview guide, and we'll be doing focus groups in the next probably 6 to 8 months. So we're doing a lot of talking to people at this point. So we're done with the policy, and we're moving on to making the connections with people about what they think we can do better. So with that, I will end it. If you have any questions about the project, talk to me or Jackie. And